Hi, my name is Nakira Lyons, and today I will be doing my informative speech on bipolar disorder. My main focus is to inform you about bipolar disorder. Have you ever met an individual who is extremely happy and in the blink of an eye their whole demeanor changed? If you answer yes to this question, 9 times out of 10 you are dealing with someone who may be bipolar. First off, I'm going to tell you the definition of bipolar disorder. According to Beating Depression, The Journey to Hope, written by Catherine Minium, bipolar disorder is defined as a mood disorder that causes periods of extreme highs and extreme lows. The extreme highs are called mania, and the extreme lows are called depression. Mania is defined as a type of bipolar disorder that dramatically affects an individual's feelings, thoughts, and behavior and causes them to be very agitated or hyperactive. The extreme lows, also known as depression, is defined as disturbance or an effect of mood with associated symptoms such as poor sleeping habits, loss of appetite, or physical problems. Symptoms for people with bipolar disorder have intense emotional episodes. There are 3 different types of episodes. You have manic, depressive, and mixed. Manic episodes include mood changes such as long periods of feeling overly happy or the total opposite, extremely sad. Some behavioral changes you would see in someone who has manic episodes would be someone who falls asleep fast, someone who sleeps very little, or someone who jumps from subject to subject. Symptoms of someone who is entering a depressive mode or episode, you will see mood changes such as loss of interest in activities that once, loss of interest in activities that at some point in time caught their attention or things that they love to do. Feeling emptied or someone who worries themselves a lot. A person in depressive state may also have behavioral changes of feeling tired or sluggish, drastic changes in their eating habits, and has problem concentrating, sleeping, and possibly thoughts of suicide. However, a person can experience a manic and depressive state at the same time, and this is called a mixed state. Bipolar 1 disorder consists of manic or mixed episodes. Bipolar 2 disorder consists of shifting back and forth from the depressive state. Bipolar disorder is found to be a disorder that is genetic and tends to run in the family. How do you get help? After reading or scanning through the Bipolar Team, written by Elizabeth George, I found ways that you could get help if you feel like you possibly have the bipolar disorder or you know someone who does. And they first said if you feel you could possibly have bipolar disorder or know someone who could be bipolar, you should consult a doctor, preferably a psychologist. A psychologist is someone who is a trained individual and has a doctoral level degree and is specialized in treating patients with mental, emotional, and behavioral health problems through the use of therapy and other treatments. Next, depending on the outcome, you may be asked to take a physical, an interview, or possibly lab tests. What cures bipolar disorder? Well, bipolar disorder doesn't have a cure, but however, there are medications out here such as lithium and valproic acid that could help your that could help your mood swings. But like always, the medicine has side effects, and some of those side effects may consist of drowsiness, dizziness, headaches, and possibly nausea. This would be my visual aid, and I really couldn't think of anything to put on my poster because it's a disorder, bipolar disorder. So of course I started with a definition, and I wrote bipolar, and I thought of words that people with the bipolar disorder experience or you would see within them, And the B, you will see behavior changes. Someone who is bipolar, the I stands for impatient. P, psychotic. O, overexcited. L, loss of interest. A, angry. And R, rage. And also over here I just did a little crossword puzzle. Not really a crossword puzzle, but stress. You have depression going down, bipolar going across, sadness, and pain. People with bipolar disorder experience all of these words. And I really couldn't think of anything else. So this face, if you look sideways, you can see a happy face, and the other side is like a sad face. This explains someone who is bipolar, because in a split second they can be happy and the next thing you know they're sad. And in this head I have a smile now cry later face, and that basically, you know, reflects off of this one. A person who is bipolar, they have happy moments and sad moments, which are their episodes. And depending on what type of bipolar disorder they could have manic or depressive. Thank you for listening to my informative speech on bipolar disorder, and I hope it was helpful to you. Once again, my name is Nakira Lyons. Thank you.